Good morning, and I'd like to welcome everybody to this presentation on how to spot borderline personality disorder. And I'm your host, Dr. Elise Snipes. The first thing that I want to point out is that personality disorders are a long-standing way of understanding and reacting to the world, which often developed to help the person protect themselves in the past. When we look at people with diagnosed personality disorders, a lot of times their behaviors are started way back when they were children, and that's really important to recognize because something happened back then that reinforced this way of behavior. In some way, it helped them survive. Unfortunately, personality disorders are often what we call egosyntonic, so it's difficult to get the person to see the problem with their behavior and be willing to change. Egosyntonic means exactly that. It is part of their ego. They don't see it as a problem. They don't see what you're getting at. So getting them motivated to change, helping them see that their behavior is challenging to other people, helping them to see that their behavior doesn't fit within societal norms is difficult. Further, people with active personality disorders, most any of them, not just antisocial or narcissistic or borderline, are generally unable to form healthy relationships because they're stuck in this protective survival mode. It is going to be up to you, and it's far beyond the scope of this short little presentation to talk about how to deal with it. But obviously, it's up to you to decide whether you can cope with these behaviors in your relationships, or if these are signs, red flags, that this is probably going to be an unhealthy situation for you. The final thing that I want to point out is that with personality disorders, like many other disorders, they're along a continuum. There is the very low end of the continuum that's not even meeting clinical guidelines, that's just a little bit eccentric maybe, all the way up to the most extreme. So you also want to examine these characteristics within the people that you're looking at or within yourself to identify where on the spectrum they are and how problematic the behaviors are. With that being said, signs of borderline personality disorder. The first one is fear of abandonment. A lot of people with borderline personality disorder derive their sense of worth from the reinforcement, from external validation from other people. So they are terrified of abandonment because if other people go away, then they don't have anybody to tell them they're okay, which means that they often get into relationships very quickly. They have very poor boundaries. It's like they meet you and all of a sudden they want to move in with you. And these relationships are high intensity. Again, they meet you and all of a sudden they want to spend 24/7, 365, they want to be in your presence. And that's important to recognize these warning signs that, whoa, this person is coming on way too strong, way too fast. Another characteristic that comes out with this fear of abandonment, when the person notices any sort of micro sign that they may be getting rejected or that you may abandon them. If you start to set boundaries, for example, it's very common for them to lash out or make impulsive gestures to keep you close. It comes out as a, look what you made me do. Going along with all of this is unstable relationships. When you have this fear of abandonment and there's a lot of manipulation and overt high intensity, it's really hard to have a stable relationship. And in these unstable relationships, the way the person feels about their significant others can rapidly and dramatically change on a dime. They will either love you or they will hate you. And there is often no middle ground. You are either their savior or you are the devil. There is really very, very rarely any middle ground. And when you switch in their mind, it's often because they have either perceived that some micro sign that you may be unhappy in the relationship or they may not get their own way. So all of a sudden they are going to put you over in the rejecting side. They want to be the rejector. They want to set up this power dynamic, so they are still in control. They may also feel suspicious. And, there are a lot of reasons why these behaviors developed and why they make sense from a developmental perspective. Again, way too much to go into in this presentation. But recognizing if you're in a relationship with someone who feels suspicious, they are often engaging in mind reading, trying to figure out what you're saying, putting words into your mouth. I know that you were looking at her, wishing that you were, with her instead of me, or I know that you wished this, that, or the other. That type of mind reading behavior and trying to tell you what you're thinking is another sign of borderline personality disorder, because the person is trying to anticipate the future. They're trying to plan, to expect, so they're not caught off guard. Which takes us to the next behavior that you see. Because of this suspicion, they often need constant reassurance. That is that external validation, and also you telling them, no, I really want to be with you. There's nobody else. They need this constant source of reassurance, because since their opinion of people can change on a dime, they often expect other people's opinions and reactions to switch on a dime. So they are on the lookout for that. They are expecting you to all of a sudden reject them. So they need that constant reassurance to keep those fears of abandonment at bay. They also have a shifting self-image. Some days they feel okay. Other days they feel worthless and terrified of abandonment. So that perception, that turning on a dime, affects them too. When one thing goes wrong, they may overgeneralize and feel like that all of a sudden they are worthless and nobody will ever want to be around them. And other days, usually when things are going right and they're getting that validation that they so crave, then they'll feel okay. But their self-image is very unstable. They can't look in the mirror and go, you know what? I'm okay. I made a mistake. I'm imperfect, but I'm okay. I'm lovable. They're not able to do that most days. Another thing that contributes to this, and you want to listen for it in their words, is that attributions are often external, global, and overgeneralized. You will hear very little responsibility taking out of someone with borderline personality disorder. Often it is look what you made me do. You made me feel this way. You made me do this. They don't take responsibility for their own feelings or their own behaviors. They also often make these global attributions. If you disagree with one thing that they say, all of a sudden you hate them and you're going to leave them. And this catastrophizing and globalizing will often prompt a lot of anger and rage out of them, because their emotions switch just like their self-perception. It's on either a yes or a no, a happy or a rageful. There is very little middle ground where they're just kind of irritated. So you've got to remember that with borderline personality disorder, it is a personality disorder of extremes. You will also see impulsive, self-destructive, or self-harming behaviors. Sometimes this is a method for the person with borderline personality disorder to feel like they have some control over something, or to numb out that pain inside their own head when they start feeling desperate because they feel like they're being abandoned. There's a lot of reasons they may do it. But if you're in a relationship, we're talking about clues here. If you're in a relationship with someone who acts out when they don't get their own way, they go speeding off in their car, or they overdose on drugs, or they engage in self-injury, or they drink to the point that they are passing out, you want to take that and consider the volatility in that person's reaction. Extreme mood swings and explosive anger go along with all of this. If they go from loving you to hating you, they go from elated to rageful, it's exhausting to try to keep up with this person. And because they switch so quickly, a lot of times you feel tense and stressed out and exhausted because you're trying to anticipate, what is it that I can say that won't set this person off? And sometimes when you're in a relationship with a person with BPD, you may erroneously start taking responsibility for it, thinking, if I wouldn't have done this, then they wouldn't have done that. And it's important to recognize your part in whatever's going on and the fact that they are adults and they are responsible, whether they want to accept it or not, they are responsible for their own behaviors. And finally, chronic feelings of emptiness. The person with borderline personality disorder often feels very empty on the inside. They don't have anything that makes them feel full of love or full of life. And that is another thing that they're trying to fill with you. Since they feel empty, if they are someone's significant other, if they are someone's best friend, that fills some of that emptiness. They've got a title to put there. But if they don't have that, then they don't know who they are. They don't know why they exist. They don't know if they're good or bad. And that causes a lot of problems and puts a lot of pressure on other people. So basically, to sum up borderline personality disorder, if you're in a relationship with someone that, goes from just meeting to all of a sudden being super intense overnight, and your interactions are ones of extremes, there seems to be a lot of suspicion, and you feel exhausted. You feel, as the book is called, Stop Walking on Eggshells. If you feel like you're walking on eggshells, trying to figure out what's going to set the person off to avoid doing that, then you very well may be in a relationship with somebody with borderline personality disorder. So that is the quick and dirty summary. Like I said, I didn't want to get into all the things that you can do to protect yourself or the impact of being in a relationship with someone on BPD. That's for another presentation. However, if this sounds like one or more of your relationships, you need to take stock of how you want to handle that for your own emotional and physical health. Thank you for being with me today.